what treatments are available for COVID-19 in Malta? Are all the variants in Malta? Will they eventually remain? Can we get rid of COVID-19? These are a few questions which we're going to ask Malta's eminent expert and worldwide expert, Chris Barbara. Chris, lovely to see you again, and thank you for coming.
Hello.
So, Chris, lots of questions. First of all, Regeneron, ivermectin, we hear a lot of these on the internet. These are touted to be evidence-based treatments which come from Australia. We hear that Germany has bought Regeneron. What is your take? What is the situation in Malta?
Yes, it's the same situation that we get in other countries as well. We try to follow all the studies which are being published in peer-reviewed journals, because sometimes you follow studies and sometimes you follow on the social media different opinions, and some people just stay flouting that this is convinced treatment, and we find that that is not the treatment which people should be taking. So we follow the advised treatment from institutions, from credible institutions, from peer-reviewed journals, etc.
So peer-reviewed means what, Chris?
Peer-reviewed, it means that your article, before being published, has been reviewed by a number of eminent people cited by that journal. And these have said that that article stands. Okay? In other words, there is enough evidence to say that there is truth in it.
So let's stick to what the authorities say and not what social media says.
This is science. Now, when you choose a cohort of patients, it could be that you have started a drug, okay? But there are other drugs. We just don't give one drug for a person with COVID. So we can give a mixture of 2, 3, or even
a cocktail
more.
of drugs.
So it could be that your result has been manipulated because of another drug and not because of the drug you're using now. We've heard of vitamin C, vitamin D, which we know are boosters for immune system. Some also work as antiviral agents as well, but it doesn't mean it works on COVID by itself.
So this is by extrapolation.
By extrapolation.
Right.
So you have to be very wise when you are interpreting these studies.
But we can be safe that in Malta we're getting the latest evidence-based, up-to-date treatment for people who come in. No better or no worse than other countries.
Not only drugs, but also hyperimmune sera, etc. So these are all things which have been used. We've been trying a lot of these. Some have been successful. Others haven't been so successful.
Right, going to the virus. How many variants are there in Malta, and will the virus continue to mutate?
Okay. Well, every virus is a variant. Every type of virus is a variant, because since the start of COVID to what we have today, we have so many different variants from the original. But what is significant and what isn't? There are certain variations in the genome of the virus, like for example N501Y, which makes the virus much more transmissible. It's like the key and lock, and the key fits very much nicely into the lock.
Right.
And in such a case, when this happens, okay, then this is much more transmissible. Some studies say even up to 70% more transmissible.
Right. But how many variants do we have in Malta?
Oh,
so numerous. This is a scoop. Okay.
No, but it's not. This happens in all the countries. It's not.
So it's not. It's the natural progression of the virus.
So if you take one small mutation in the virus, okay, it's still a variant, but it doesn't mean this is going to cause a big alarm in the management.
So this is natural selection. This is
but
surviving.
Then if there are variants in particular areas of the genome, then that is of concern, both in the management, both in the transmissibility, both how our immune system is going to react to that. So these are all important.
So it's more transmissible, but not necessarily more aggressive.
Exactly.
Fine.
So you can have variants,
right,
which are just coincidental variants, and we have a few.
So the variants are happening all the time, okay?
Exactly.
This is to address all the scaremongering and the concerns.
And the bigger the numbers of COVID we find, the bigger the number of variants are created.
Okay.
But these are mistakes.
Right. Chris, the present vaccine, there's a lot of work about them. Can we say that they cover these variants, this evolving variation of viruses?
It depends. It depends where the variation is, okay? sometimes the variation happens where the virus tries to escape the immune system. Now, the immune system could be the vaccine, and the virus with these particular variants, like for example the South African variant, or sometimes even the Brazilian, but especially the other one, you can escape the antigen or what the immune response is by that vaccination.
Okay.
So sometimes you require much more antibodies
Yes.
for you to be protected with a variant.
But is it correct to say that the vaccines so far are covering the variants we
In
have?
Malta, we've only discovered the main variant is the UK variant.
Okay.
And that is still working well, at least with the Pfizer and with the Moderna, they work well.
Right.
And we think that with the AstraZeneca as well.
Right. Are we looking at combining vaccines to have a more efficacious
Yes,
immune response?
There's currently a big study going on because logistically to keep stock of the same vaccine and having a booster with the same vaccine might logistically not be so easy.
Right.
So companies are looking at whether you can start with one vaccine
Yes.
and continue with another
Yes.
one.
The fact that you can't give AstraZeneca to the over 55s, can you please clarify once again?
You can give
You can.
to over 55s. The European Medicines Agency or
Right.
authority has said that you can. Locally, and some other countries are doing the same, we've seen that in the clinical trial there haven't been enough numbers in the clinical trial in people over 55.
So it's a caution, it's not an absolute
We
contraindication.
don't want to take risks. When I cross the road, I go through the traffic lights or through the zebra crossing.
Right.
Okay? This is the same thing.
Right.
Because we haven't seen large numbers over 55 in the clinical trial, before we see those numbers, we are not going to give it to over 55.
Evidence-based. Chris, have there been any fatal side effects in Malta with any of the vaccines so far?
Absolutely none. So-
Absolutely none.
Absolutely.
Okay.
The majority of the participants who took not participants, people who took the vaccine, had mild side effects. There were a few who had more severe vomiting, feeling unwell, tiredness.
But-
Some people said I've been run over by a car.
Right.
Okay.
Okay.
But these are the few cases.
The feeling
but
of-
it is still worth the investment.
But it's temporary and it's transient and it
And
just
it's
goes with
reversible.
conservative.
It's
Perfect.
reversible.
Chris, a lot of people are asking, if you get the vaccine, can you be infected by COVID again? And number two, can you still be a carrier for other vulnerable people?
With the Pfizer, Moderna, both these vaccines, in the clinical trial, they didn't take a swab checking that the person is not a carrier. They just checked for symptomatology.
Right.
So certainly, although you're not going to give any virus within the vaccine, you can still get a milder disease with no symptoms and be a carrier. Probably not. So probably it's not the case.
But caution is always key.
Of course,
Social
so we
distancing.
should keep the social, we should keep wearing the mask, etc.
Right.
But the big probability is that you are not infected.
Okay.
But this hasn't been proved. But with the AstraZeneca, in the clinical trials, they took a PCR swab after both vaccines,
Yes.
okay? And the majority, depending on the effectiveness of the vaccine, were negative.
Right. Is there any age group where people are more vulnerable or prone to be carriers as opposed to non-carriers? We heard that children in the beginning were carriers.
Yes. And this is varying all the time. We are seeing that possibly now with the new variant, this is affecting more younger age groups.
Okay.
But this is still under study.
Right.
We're also doing studies locally to see which numbers of people who are just asymptomatic and carriers and whether they are variants and which age groups. We don't have the data yet.
So as you can understand, there's a lot of work going on, and well done to the Department of Health, to Professor Chris Barbara, to everybody. This is really putting all the pieces together. The pieces are changing and evolving. So when policies come out, lockdowns, closing schools, all the factors have to be put in. Chris, last question. Will COVID-19 ever go?
It's very difficult to completely eradicate a virus. It will still continue circulating around. But once we are protected with the vaccine, and possibly with the amended booster vaccine once the variants the variant always tries to take the place of the normal COVID
So it's a
virus.
cat and mouse. We're chasing
Exactly,
each other.
but then the new vaccine will then protect us against the variant as well. So each time the virus tries to jump from one person to the other, if the other person is vaccinated, then it can't replicate.
And this is a bit like the influenza vaccine, isn't it? So
Very
we're
much
doing,
so,
we're
but,
not doing
but we
anything
have a much more effective vaccine this time. For COVID, because influenza is 60% effective. Here we have 90% or 95%.
Right, and AstraZeneca 70% or?
It depends. It depends how we're going. Because this new study will now show us if you mix and match, you can get a better effectiveness.
Chris, thank you very much. And as I always say, what better way to address psychological issues than getting information from the horse's mouth? But as always, if you are in crisis, and many people are in crisis because of this issue, let's use the COVID-19 saga as an opportunity to be better as a nation. And if you need anything, please get the information from the right source. Thank you very much, Dr. Barbara. All the very best. Thank you.